So I started off as a practice nurse. You can start off as a healthcare assistant these days, but there's primary care nursing. Then you go into, I became a nurse practitioner, I did about 5 years as a practice nurse, then did my nurse practitioner training, and as part of that I then did my independent prescribing. And in addition to working in general practice as a nurse practitioner, I also helped doing mentorship and preceptorship for new nurses coming into the primary care unit.
You can then go on and do the nurse practitioner degree, which gives you a much more medicalised approach to practice nursing. So you then become much more able to diagnose, refer, prescribe. There's lots of opportunities to go in practice nursing. You get to meet lots of people. It's really good fun. And the beauty about general practice in nursing, you can progress if you want to and do more extensive roles. And after having done that for years, and I took more of a managerial role within the practice and budget forecasts and rotas and hiring and all that sort of stuff. So then I became a nurse consultant.
By treating the whole family, you see the domestic side of it, the support networks that they've got or not, as the case may be. But I think you do get to know your patients more closely than you do in a hospital setting.
The best thing about my job, one, is the people. General practice, the GPs are really supportive. We all work as a team. It's much nicer than hospitals. It's much more secure, the hours are much nicer, the people are much nicer, and the patients, you get to know them really well. So you get to know not just the patients but also the family, and you see them over years and years.
I think now, the holistic care of the patient, we see patients for years on end, whereas in the hospital the care of the patient is much quicker, people are in and out much quicker than they used to be. And we get to know patients so well, and it's invaluable for students to see that side of care, really, particularly in general practice. I mean, it's an eye-opener for them, I think.
My patients make me proud. They're happy to come in, and you get to know them on a one-to-one basis, so they come in and call you by your first name. It's very informal. Being able to support your patients and knowing that you've helped them and get through their various diseases and that you're supporting them all the time.